All right, good afternoon and welcome to this community briefing on our ongoing pandemic response efforts. I just want to note that we are having some difficulty with our internet, and so if you are watching this on social media, you may experience choppiness in the video, but we will have this recorded and we'll provide information about where you can see it on our TV channels at the city later after the end of the briefing. I also want to say thank you to Margie Propp once again for being here to provide interpretation. And thank you to all of you for your patience as we get started today. So when I opened my email this morning and found the message from Director Lopez with today's number of people hospitalized with COVID-19, my heart sank.
This meeting is being recorded.
The number of people in the hospitals is high, and it's moving in the wrong direction. And this is not where we hope to be. It's not where any of us hope to be heading into the holiday season. And of course, the heartbreak in all of this is that these hospitalizations are largely preventable. With so many new tools at our disposal, vaccines for younger age groups, booster doses, our case rates and the pressure on our hospital system could and should be declining in this moment. However, not everyone has taken advantage of these tools. And of the members of our community now eligible to receive the vaccine, 62% are vaccinated. And while that means thousands and thousands in Lincoln and Lancaster County have stepped up to protect themselves and their families, it also means that we have more work yet to do. We are making progress. Consider, for example, that in that hard-to-reach 16 to 24-year-old age range, more than 50% are now vaccinated in Lancaster County. Still, we have the tools to do better. And if we want to put an end to this pandemic, we as a community have to do better. So let's discuss these new tools and how we can, as a community, come together to beat back the Delta variant. While COVID-19 vaccines continue to provide protection against severe illness, hospitalization, and death, it's common for protection from vaccines to decrease over time. And that's why we welcomed news late last week that the CDC approved Pfizer and Moderna boosters for all adults ages 18 and over. We have seen progress with boosters already, even before this eligibility was expanded. More than 53,000 Lancaster County residents have already rolled up their sleeves to receive a booster dose or third dose. And with the expanded recommendation coming from the CDC, now more than 80,000 residents are newly eligible for boosters. To reach everyone eligible for a booster, the health team is expanding its booster dose clinics to include all adults. And the first one was at the health department earlier today. Many local pharmacies are also providing boosters, and there will be many convenient opportunities in the coming weeks for anyone who is eligible for a booster to receive one. Everyone who gets a booster receives the benefit of added protection and peace of mind as we enter the winter months and the holiday season. Here to talk more about our current situation and what it will take to turn things around is Health Director Pat Lopez.
Thank you, Mayor. As the Mayor mentioned, everyone 18 years and older is now eligible for a booster. Pfizer and Moderna booster doses are currently approved at 6 months after the second dose for all adults 18 and over. The CDC already recommended booster doses for the Johnson & Johnson vaccine for all adults that had 2 or more months after their initial dose. We are urging everyone who is eligible to receive their booster dose as soon as possible so they have that extra layer of protection. We have several upcoming clinics that will include booster doses. People can check availability and schedule an appointment at covid19.lincoln.ne.gov. People who don't have online access or need assistance can call us at 402-441-4200. Ensuring people have ongoing and convenient opportunities to receive vaccine remains a top priority, and recently our focus has also been on vaccinating children 5 to 11. We held a clinic at Southwest High School on Saturday, and we'll be providing some second doses to children in that age group right after the Thanksgiving weekend. As you can see on this chart from our dashboard that shows the percentage of population vaccinated by age group, around 21% or close to 6,000 children in our community, the ages 5 to 11 years old, have received their first dose of vaccine. COVID-19 vaccine helps keep children healthy and in school and allows them to safely join in-person activities. It is their best protection against the virus. Vaccination remains a critically important tool to help control the spread of the virus in our community, and we are urging everyone to get vaccinated, whether it's a first dose, second dose, or a booster dose, as soon as possible. Our local situation continues to be serious, and it's not improving. Last week, the COVID-19 risk dial moved up to the mid-orange level, and due to a continued increase in new cases, higher positivity rate, and strained hospital capacity is staying in the mid-orange today, meaning the risk of COVID-19 spread and impact in the community is high. We have experienced a steady increase in cases since October 25th. On the chart, you can see the 7-day rolling average increase from 80 cases a day to an average of 130 cases toward the end of last week. This is an increase of 62% in about a 3-week period. In addition to increasing cases, we have also seen an increase in positivity rate for people being tested at local clinics and test sites. Since mid-October, the positivity rate has risen each week and was 13.6% for the week ending this past Saturday, November 20th. The high number of new cases are resulting in more people with COVID-19 seeking medical care and being admitted to our hospitals. The 7-day rolling average of COVID-19 patients hospitalized locally shows that the daily average had been fairly level the past 3 weeks at about 90 patients. However, last week we did see an increase to an average of 96 patients on Saturday ending November 20th. Today, Bryan Health and CHI St. Elizabeth's reported 100 COVID-19 patients. 68 of those patients are from Lancaster County. Many of these people are very sick, and some are in critical condition. Typically, 80% of those patients are unvaccinated, and patients requiring intensive care are almost always unvaccinated. When we see case numbers going up, we can expect to see a corresponding increase in hospitalizations, which will add more stress on our healthcare system. Local hospital capacity continues to be a very serious concern for all of us. This graph you're seeing now shows Nebraska data on hospitalizations by vaccination status. The black line at the top is the rate of hospitalizations among people who are unvaccinated. The blue line at the bottom is people who are fully vaccinated. As of late October, 20 out of every 100,000 unvaccinated people in Nebraska have been hospitalized with COVID-19 each week, whereas only 2 out of every 100,000 fully vaccinated people are hospitalized each week. This is a ratio of 10. So the rate of being hospitalized with COVID-19 in Nebraska is 10 times lower if you're fully vaccinated. Some people who are vaccinated will still get hospitalized, but this emphasizes the protection vaccine provides. We have no deaths to report today. And so far in November, we've lost 12 members of our community to COVID-19. As we've shared before, an approach based on data and actions we've taken together as a community is what makes sense for Lincoln and Lancaster County. This fall, our local health-directed measures have been limited to a single intervention, requiring masks indoors. Wearing a mask is a common sense prevention method that can help control transmission, but in the least restrictive manner. Think back to where we were last November. It was a difficult time with a lot of measures in place. This year, we are fortunate to have safe and effective vaccines, and those vaccines are available to almost everyone. The only prevention measure required is wearing a mask and getting vaccinated. This November, our situation is different, but so is the Delta variant. As the mayor indicated, and I will say again, Vaccination remains an essential and effective tool to help protect ourselves, our loved ones, and our friends and neighbors. And it reduces the impact of COVID-19 on our hospitals and in our community. The Delta-driven surge has made it necessary to use other public health tools like masking to help slow the spread of the virus and provide time for additional groups of people to get vaccinated or receive boosters. If we want to move our community forward, we need to continue to vaccinate. The plan is to have the mask requirement remain in place this month to give an opportunity for children ages 5 to 11 to be fully vaccinated, for adults 18 years and older to receive their booster doses, and for others to get vaccinated if they haven't already. As the pie chart shows here, 62% of our population is fully vaccinated. Now we need those 5 years old and up to get vaccinated, and those eligible for boosters to receive them. Vaccinations are the priority, and the next few weeks will be critical, so please get in and get your vaccine and help improve our community situation. COVID-19 vaccine is available in our community every day. You can find upcoming vaccination clinics at covid19.lincoln.ne.gov or by calling us at 402-441-4200. You can also find local pharmacies offering vaccines at vaccines.gov or by texting your zip code to 438-829. On a final note, we're starting the holiday season with Thanksgiving this week. Like I mentioned, this year looks a lot different than last year, and many people will be celebrating together. It's important to remember to celebrate safely. And with that, we'll take any questions.
This is Bill at 1011. Did you have a hard date for that extension?
December 23rd, Bill.
Sorry, that was the 23rd.
I'm gonna have folks type it in chat in case they're trying to communicate.
Okay. We're just checking the chat. Hi.
It's Matt Olberding, Journal Star. Hi, hey, so we've had the mask mandate in place now for approximately 3 months, and we've seen a pretty steep rise in cases during that time. So, I mean, at what point do you sort of diverge the mask mandate from case numbers? Because so far it doesn't seem to have made a whole lot of difference. It seems like vaccination is the one thing that would, make the difference in case numbers and everything. So, I mean, is there a point at which you just sort of, I don't want to say give up, but say it's not working, it's not being effective, there's no reason for it anymore? Or do you think the mask mandate is just going to continue indefinitely until case numbers come down to a more reasonable level?
That's a great question, and one we've been reviewing. I want to make it clear that we don't know how many cases of COVID-19 the vax mandate has prevented in our community. So it really is an effective tool. We have plenty of information on that. But what I was saying in talking today to just help clarify is that our intention is that we are allowing this time until December 23rd for anyone who is eligible to be vaccinated to get vaccinated. We are urging them to do it. At that point, our plan is to only extend the mask mandate until December 23rd. If our hospitals go into crisis standard of care or some other things happen in the community, we will have that discussion and provide more information. But we're asking people now to take that responsibility and get vaccinated. That's what's going to turn the situation around. And as with this pandemic, as you've seen and everyone's seen, We have to be flexible. We have to move as we learn new data. And every day we're learning new measures and new methods. But the one thing that is steadfast is that right now we have a safe and effective vaccine, and I am urging people to take advantage of that.
Okay, so, I mean, cases have continued to go up pretty steadily. I think last week compared to the previous week, it was almost a 20% jump. If those continue to go up and the indicators push us, say, into the red on the risk dial, are you at this time considering any kind of other mitigation efforts besides the mask mandate, such as capacity restrictions, limits on hours of operation, anything like that?
Right now, our focus is really on, we need people to get vaccinated. We don't have to have other restrictions if people will simply get vaccinated. Our hospital capacity will improve, our case numbers will decrease, but we also have several people coming into the community that don't follow our same guidelines and that aren't vaccinated. So those are things we're going to have to deal with all the time. But at this point, we know that the vaccine is the way out of this situation. And so we're going to be steadfast in that message.
Great. And then just one more quick question for you, and I'm not asking you to speak for LPS, but have you discussed with LPS that December 23rd date? If you guys decide not to extend it, have they talked about dropping their mask mandate, or are they going to consider that separate from the county's position?
You know, I can't speak for LPS, but I have had conversations with all of the school administrators, both in Lincoln, in the city, and the county, and they are aware of the plan, and they are supportive. I've spoken with our health systems, I've spoken with our physicians about where we're at now in the community, and they are all supportive of what we need to do now that we have vaccine available for 5 to 11-year-olds, and anyone over 18 can get a booster or get vaccinated. That's what we need to do to move forward. And when you say what's happening in Lancaster County, cases are going up everywhere across the state. The hospital capacity is stressed in every situation. There are people waiting in the emergency room. There are people being taken care of in critical access hospitals that don't have the proper equipment and staff, but those are the only alternatives. This is the situation we're faced with, and it's up to everybody to take that responsibility to get vaccinated.
Okay, thank you.
Director Lopez, this is Bill again, and I just want to clarify a previous statement. I think you might have cut in or cut out a little bit. If the plan here for this last extension is to give everybody the opportunity to get vaccinated if they're previously ineligible, that's people with the booster availability in the 5 to 11-year-olds. And then as long as there's no hospital crisis standard of care, it is likely to expire on December 23rd.
Bill, I think you misunderstood. I said that we will look at those things if something comes up like that changes where we're at. You know, all through this process, we've had to adapt and change, and we will. But right now, today, our plan is to focus on getting people vaccinated and not doing an extension. But if something happens that changes that, we will certainly make an announcement as soon as possible. But that is our plan. So what we need now is those community members. We have 62% of the members of our community that have come forward and are vaccinated to help protect us, their loved ones, their neighbors, and family in our community. We need everyone else to do the same.
Thank you, Matt.
Thank you today, and I hope all have a safe Thanksgiving. Please wear your mask, and please get vaccinated if you aren't, or get your booster.